And as we continue our discussions with Breast Cancer Awareness Month, welcome back everyone. As we just mentioned, that is October, Breast Cancer Awareness Month. Christy Riggs and Farrah Jones from Western Kentucky Diagnostic Imaging join us this midday to talk about not only that, but also Western Kentucky Diagnostic Imaging being named a breast imaging center of excellence, the only one in the region. Thank you all so much for being here.
Thank you so much. As you know, historically, October is Breast Cancer Awareness Month. And although every month it's very important when it comes to women maintaining their annual mammograms, October is the month that we set aside every year for our annual campaign, and that is just to increase awareness on the impacts of breast cancer and to remind all women the importance of getting those mammograms. They really do save lives.
They really do, and I've heard and talked to many experts, doctors, about, you know, the younger you can get the mammograms, the better, because catching that early is vital and so important. So you all have a center, you know, for women and men alike to come and get treatment and get, you know, the screenings. Talk a little bit about the center you all have here, the only one in the region. Whoever wants to take it. The Breast Cancer Center, you know, was named a Center for Excellence, the only one in the region. It's a new 50-50 program from the foundation that you all have. Can you talk a little bit about that and what it offers?
The breast clinic is down at the hospital, at the medical center. They're open Mondays or Tuesdays and Thursdays from 1 to 3. You can go in on a walk-in basis. If women feel a lump or they have any skin changes and they want to be seen, if they don't want to wait to see their family physician, they can walk into the clinic and meet a member of the team there. They can expedite their mammograms or ultrasounds, whatever they might need to have, and then get them on the treatment path that they're needed. You know, a lot of times it's not anything, and so they can give good news to patients as early as possible, but if they do detect something, then they can get them on the right path to treatment.
Yeah, because even if it's bad, you know, getting that treatment early.
Absolutely.
And WKDI is a breast center of excellence. That's separate from the walk-in clinic, and we're actually employed at WKDI.
Okay.
The breast center of excellence, we got our accreditation in the spring of this year. We're accredited in mammogram, ultrasound, stereotactic biopsy, ultrasound guided biopsy, and MRI. So we have that accreditation. It's kind of like a one-stop shop.
Yeah.
You know, you have your mammogram, it comes back abnormal. You come back, you have a diagnostic mammogram, ultrasound if you need a biopsy, whether it be a mammo-type stereotactic biopsy or an ultrasound-guided biopsy.
And we are really proud of that.
Yeah.
All breast imaging modalities had to achieve accreditation with the American College of Radiology for us to be awarded that distinction. And we are just so proud of the team of technologists that we have at Western Kentucky Diagnostic Imaging and the work that we're able to provide for our community.
Well, that's so important. I've spoke with survivors of breast cancer and some patients that are currently going through it, and they say how important it is to have a center that's close than having to travel elsewhere, you know, because that just puts unnecessary stress on what they're already dealing with.
Right.
Absolutely.
And so what should women do just to be encouraged, and men too as well? I mean, it's more common in women, but men suffer from breast cancer as well. What can they do to raise awareness during this month and to obviously get the checkups and the mammograms that they need, but what should women be encouraged to do?
Well, the American Cancer Society recommends that all women of average risk start their screening mammograms at the age of 40. So average risk would be for anybody that does not have a personal history of breast cancer, who does not have a family history of breast cancer, but also does not contain that genetic mutation that might increase your risk of developing breast cancer called the BRCA gene. However, for women who are at a higher risk, they would want to speak to their family physician to see what age would be most appropriate for them to start getting those mammograms.
Well, I know it used to be a higher age, but now, you know, they've lowered that age to 40 now, so that's so important, I think, to get the word out on that as well. And you all started the Med Center Health Foundation, just announced the new 50-50 donation program to benefit women who otherwise might not be able to afford some care and treatment. Can you talk about that? Do you know anything about that?
I think that program is trying to help women who might not be able to afford getting their mammograms, may not have health insurance. I think they're looking for 50 donors to donate $50 to go toward women getting those mammograms.
That's so nice to be able to do that and give back as well. Is there anything important that you all wanted to know that I haven't asked you, just to talk about Breast Cancer Awareness Month or you know, the diagnostic center that you all work?
Well, I think it's just very important. We cannot iterate how important it is for these women to get out there and get their mammograms, and just know that the earlier we can detect this disease, the higher those survival rates are going to be. I know that Susan G. Komen released a survey back in 2019 that showed only about 40% of women who did not have health insurance had had a mammogram in the last 2 years. Now that number went up to about 75% for women that did have health insurance, but it still leaves a lot of women out there that continue to shy away from those mammograms for whatever reason, and so we just cannot encourage them enough to go get those screening mammograms. They really do save lives.
Well, where are you all located?
We're located on 1635 Scottsville Road. We're kind of across from Steak and Shake. That's just, we always, right.
Okay, well, thank you all so much for joining us. We really appreciate it. Thanks for being here. If you're interested in getting any care and you need to look for some, resources in our community, you can always reach out to them and go to their location that she just mentioned. That info is up on your screen, medcenterhealth.org. They have all the information up on their website as well. 1635 Scottsville Road is their main location, 270-780-2720. They can direct you where to go in terms of breast cancer and awareness and getting some care. Thank you all so much for being here.
Thank you so much for having us today.
Yeah, absolutely. We'll be right back.